How do we differentiate between low back pain and SI joint pain?
It's a good question. We do get that a lot. Patients present to the office, and usually the presenting problem is, I have back pain. Once you start asking further where the back pain's located, when it occurs, then you can start to parse out the differences between low back pain and SI joint pain. SI joint pain is usually on one side or the other, unilateral. Back pain is usually in the middle of the back and goes on either side from the middle of the back, but it's usually closer to the midline. SI joint pain is located over a portion of the hip bone, which is called the posterior superior iliac spine, or PSIS. And usually when you palpate over that area, it elicits a significant amount of pain. There's a reproduction of that pain. Also, we do different provocative testing to ascertain whether it's the SI joint or if it's the low back. Some of those tests we would do in the office on our physical examination. At the end of the day, the SI joint is really a very mildly moving joint, and it only moves maybe 1 to 2 millimeters, that is between the sacrum and the ilium, or the hip bone. And it's surrounded by massive ligaments that really restrict a lot of motion, but it is actually a joint. We can see over time arthritis develop in the joint. When we do CAT scans or x-rays of the joint, you can see what we call vacuum phenomenon, where the joint really loses some of its fluid and it's replaced by what looks to be gas within the joint, and that's the vacuum phenomenon of the SI joint. The way we then deal with that is we would send patients who we suspect of having sacroiliitis or SI joint dysfunction. We'd send them to a pain management doctor to do an SI joint injection. And they would use various medications to do an injection that's either going to be diagnostic or therapeutic. The diagnostic injection will typically tell us if they get 70 to 80% improvement, then we know that it's likely the SI joint, and then we would move to a more therapeutic injection, which would potentially give more long-term improvement of the SI joint symptoms. If all else fails, then there's a minimally invasive procedure we do to actually stabilize the SI joint through a small incision, and we insert either 3 titanium dowels or screws that actually help to stabilize the joint. It's a very minimally invasive procedure. It's a same-day procedure. Patients ultimately go home the same day. That procedure should be done by a surgeon, either a neurosurgeon or an orthopedic surgeon, because there are obviously significant risks with malplacement of either screws or titanium dowels.